As SPEED, we are working mainly in 3 areas which are contributing to universal health coverage in Uganda. One is trying to build expertise within the universities to do policy analysis, policy influence, but also to advise government. And that takes us to try and define problems on the ground, or at least respond to problems as they are pursued by government, and put them into a language, but also package the evidence in a way that can enable decision makers to make a decision, as opposed to providing evidence that something works, but this time going beyond the evidence that it works to how will it work in Uganda. And that requires customizing evidence to the local situation, to the local problem, but also the capacity of the system. The other area is we are also trying to ensure that the stakeholders all across government understand what they have to bring to the table to achieve UHC. So that involves building a vision for understand, so that everybody understands it. So we're creating forum for them to come and share, learn, and try to respond appropriately. We have been holding symposium now. So far we have two, 2015 and 2016 one, looking at how different players can play a role. We are also creating a mechanism for decision makers to monitor the policies that they have passed. How are they being implemented? And particularly, we are interested to see that when a policy is passed, policymakers continue to remain with it during implementation, so that they can help solve the problems that definitely will come up and requires that they are still engaged, whether it is money they need to provide, or appoint authorities, or ensure that people are collaborating adequately, because this requires many actors, and unless policymakers remain focused, we don't achieve what we need to achieve. The other area where we are doing work on this is generating special studies to look at special areas of research. Like now we are looking at malaria, particularly the preventive side of malaria. We are doing a policy paper to help us understand what will it take, for example, to scale up interventions like IRS. We're also looking at how do we mobilize and use multi-stakeholder engagement for especially the work we are doing with WHO on social determinants of health. We've also been commissioned to look at how do we work with private sector to advance universal health coverage. It's a partnership of 6 agencies. Makerere University, of course, is one of the partner, and in this case is the lead partner, particularly the School of Public Health. We also have the Uganda Health Consumers Organization. This is an advocacy agency. We're also working with the Economic Policy Research Center. It's a sister organization in the university that brings on board these competencies of looking at cost economics and the whole idea of macroeconomy, which tend to be key considerations for decisions to be made, especially for public health. In South Africa, we work with the Human Research Council, which is an agency which does a lot of work on the political science and particularly the politics of development, and they help us to bring these skills and competence of understanding what the politics are behind decisions and policies that we are engaging in. And up north in Antwerp, in Belgium, we're working with the Institute of Tropical Medicine, which is helping us again on the agenda for health systems development. In the government, we are working with the National Planning Authority as a partner. National Planning Authority is the agency that has a mandate to plan for across government. Every sector has its own plan, but National Planning Authority is the agency that guides all the other departments to plan. We thought that was strategic to have those as a partner so that we can reach beyond the health sector.